I'm Annie Murphy, and I'm the director of the Framingham History Center. As I was saying to somebody about this organization, that there are few organizations in the area that have the kind of programming we have and the kind of audiences that we get. And it's really very exciting. So thank you all for coming. As I said, there's a volunteer theme here, and Kathy Hursen is a volunteer at the Framingham History Center. And she's been here, I'd say, about 5 or 6 years, because you did the TB program in 2016, I believe. In any case, she's on our program committee now, and because of the amazing health history in Framingham, it's wonderful to have her here and keep reminding us to do these great programs. Kathy served as the public health nurse manager and manager of the regional TB clinic in the town of Framingham from 1989 to 1996, and she's the Director of Education and Training at the Massachusetts Department of Public Health Division of TB Prevention and Control for 15 years. She has 30-year experience in public health. She is a graduate of Framingham State University and the University of Massachusetts Medical School's Graduate School of Nursing. She was Program Secretary of the Nursing Section of the International Union Against Tuberculosis and Lung Disease, and she chaired that organization's nursing section of the North American region. She serves as a member of the board of the Independent Association of Framingham State Alumni. Also, Dr. Al DeMaria, thank you so much for coming, Dr. DeMaria. Al has served as the medical director and continues to provide consultation to the Bureau of Infectious Disease and Laboratory Sciences Response and Services in the Massachusetts Department of Public Health. He was the state epidemiologist for Massachusetts from 1990 to 2018. He has been involved in applied epidemiology and public health surveillance for 25 years. He's a graduate of Boston University and Harvard Medical School. He trained in international medicine at Montefiore Medical Center in the Bronx, New York, and in infectious diseases at Boston City Hospital and the Boston University School of Medicine. He is the president of the Massachusetts Infectious Diseases Society and fellow at the Society of Healthcare Epidemiology of America. Let me tell you, this is a lot of... He is past president of the Council of State and Territorial Epidemiologists and the Northeast branch of American Society for Microbiology. He serves as a member and advisor on several committees in the Massachusetts Medical Society, and he is on the board of the Public Health Museum, which is in Tewksbury, Massachusetts, and if you get a chance, you should really go visit that museum. So thank you to both of you. I believe Al is starting.
Thank you. It's great to be in the city of Framingham and to be on a program with the fantastic Kathy Hursen. And it's always a pleasure to do these programs with Kathy. What I'm going to do is give you an overview of influenza, an overview of the 1918 pandemic as it occurred across the world, sort of to provide some background, and then Kathy was going to hone in on Framingham and what happens here. So, just looking at the audience here, I know some people know more about influenza than others, but I'm going to start sort of just giving some background about what influenza is. It's a disease of the respiratory tract. So there really isn't a GI flu. You can call it a GI flu. And flu-like symptoms mean many things to many people, but when we talk about the disease influenza, we're talking about a respiratory tract infection that can involve any part of the respiratory tract, but usually the upper respiratory tract. And it's not really a cold, it's the flu. And the flu is different from a cold in that typically it occurs suddenly with all of the symptoms: fever, muscle ache, headache, cough, sore throat, runny nose, everything at once, whereas a cold tends to come on gradually. And that's how I would differentiate a cold from influenza. And there are it's caused by a virus, and there are 3 kinds of influenza virus, A, B, and C. In fact, there's actually 4 now because one was discovered in cows. Whether that's going to have any significance for any of us remains to be seen. And when we're talking about pandemic influenza, we're talking about influenza A. And influenza is transmitted by respiratory droplets. The virus is in the respiratory tract, gets into the respiratory droplets, and gets spewed out into the environment. And if those particles get in your nose, your eyes, your throat, it can cause you to get influenza infection. And it's highly infectious. Influenza is highly infectious. So there's a lot of virus in those droplets. And you can actually be infectious yourself before you have symptoms, because the symptoms come from the damage to the airway. And you can become sick within 2 days of exposure. There aren't too many diseases that can do that. But that means that you can get sick very, very rapidly after exposure, and you're infectious before you're symptomatic, and you're highly infectious once you become symptomatic. So there's a lot of opportunity for influenza to spread. That's one of the main reasons why it spreads so rapidly, because of that 2-day incubation period from exposure to disease. And then people are infectious for about 7 to 10 days. After 5 days, infectiousness goes down substantially. And children can be infectious for a much longer period of time. And all of the studies suggest they're really the vectors of infection in the community. So that's especially important for their sake to vaccinate them, and for our sake to vaccinate them so they don't spread it. And I don't want to get into too much detail on the biology here. The influenza virus has 2 proteins on its surface, hemagglutinin and neuraminidase. That's where the H's and N's come from. H1N1, H3N2, you hear about that. It's because those are the proteins on the surface of the virus. And the H allows the virus to attach to cells and infect cells. If they can't attach, they can't infect the cells. And the N allows them to detach from the virus. And if they can't detach from the virus, they can't go on and infect other cells, because viruses must get into a cell to cause infection and to replicate, to reproduce themselves. And the genome of the virus, the genes of the virus, are on 8 segments. This is unusual for a virus, unusual for an RNA virus to have segments, almost like chromosomes. So you can get mixing and matching, just like we got mixing and matching that results in us. We get some chromosomes, some genes from our parents, some from our fathers, some from our mothers. And that can happen with these viruses, so they can come out looking very different. And influenza A viruses that cause pandemics are bird viruses. They can infect birds. In fact, all the influenza viruses can infect birds. Actually, there's some newly discovered influenza viruses that infect bats. There's a flight thing involved here, but the bird viruses are very important because they can spill over into other species. And virtually every species of mammal is potentially susceptible to an influenza virus. And it all depends on what those receptors are. Basically, all species of mammals can be affected by these viruses. And there have been multiple pandemics because these viruses are highly variable, and they can develop new strains with new capacities to infect a variety of species and humans. And importantly, they can have new characteristics as a totally new virus in a population that has never seen that particular virus before. So we've had multiple pandemics starting in 1889, 90, 1918, 1957, 1968, and then 2009. And you can see those H and N's coming in there because new H and N's can emerge and cause infection. And in 1889-90, there was a pandemic of influenza that was recognized as such. They didn't know it was caused by a virus. And that influenza virus actually killed the heir to the British throne, Prince Albert Victor, who was George V's older brother, would have been king if he hadn't died of influenza in 1892. So we're talking about 1918 today. That was the first big epidemic, and sort of the age of microbiology. And although they didn't recognize that it was a virus, they did recognize that it was a contagious disease. And you can see the impact of the 1918 influenza pandemic in this graph of deaths in Massachusetts. We had the first death registry, a statewide death registry, in 1842, and you can see infectious diseases killed many people in the 19th century. It was the #1 cause of death. 50 to 60% of all deaths were due to infectious disease, and 1/3 of all deaths were due to tuberculosis. And then the pandemic of 1918 had a huge impact on mortality and life expectancy. It was the only time that life expectancy went down in the 20th century. Unfortunately, life expectancy is actually going down in the United States right now. Not dramatically, but significantly. But the 1918 pandemic was the first big impact on life expectancy. And unlike other influenza epidemics or influenza pandemics for that matter, the 1918 flu differentially killed people between the ages of 15 and 45. Now, nobody really knows why that happened, but the best hypothesis is that it stimulated an overwhelming immune response that in and of itself caused the significant illness and mortality in that age group. Older people had some degree of immunity to similar influenza viruses, and younger people did not have that same impact. Traditionally and historically, the very young and the very old are most at risk of deaths from influenza, but 1918 was different. So it caused huge outbreaks, and especially in the military, because they were recruiting for the war. So this was a mobilization of the U.S. military forces, and those were exactly the age group that was, those people were exactly in the age group that was most impacted, both by the attack rate of influenza, so they were more likely to get influenza, because they were living in cramped conditions, crowded conditions, they were more likely to spread influenza, and they were more likely to die of influenza. And that impact was huge. This is from Fort Devon in 1918, one of the first places in the second wave of influenza. The first wave seemed to have happened in Kansas. It was relatively limited, but the second wave was the big wave of influenza that started in the United States, started in Massachusetts in August, and then reached a peak in October. And this is also Fort Devon. It was overwhelming there, and literally knocked people out. People could wake up in the morning, get sick, and be dead by the next morning. Or they could get sick and a few days later develop a pneumonia superimposed on their influenza and die. There was a great mobilization of nurses and physicians in the United States and all over the world for that matter, to deal with this. But remember, this was the mobilization for World War I, and many of the nurses and physicians were already over in Europe. So there was a shortage of nurses in particular. And the nurses were critical here, because doctors really couldn't do anything. What were they going to do? They didn't have any medications. They made rounds. This person's very sick, take care of them, nurse. And it was the nurses that were necessary to care for these people with influenza. So the mobilization of nurses became a major effort in the war against influenza. And there's many, many descriptions of whole families dying of influenza, or the parents dying and the children being left behind. And the public health nurses and the local officials coming to people's apartments, people's houses, and finding that the parents had died and the children were left orphans. And every time I give a talk about 1918, there's always somebody in the audience who had a relative who died in 1918. In fact, I've run into people who never really knew that who they thought were their parents were really not their parents. They were adopted after the influenza pandemic, or their parents were adopted after, and they find out their grandparents weren't who they thought they were. So this had a huge impact. And it was called the forgotten pandemic because it was happening during the war, so nobody wanted to talk about it. Although people did talk about it, and there were headlines about about influenza. People did not want the full impact to be appreciated because it would hurt morale in the war. So, and then once it was over, people wanted to put it behind them. They didn't want to remember it because it was a horrible experience. This is Seattle police trying to deal with influenza. This is the digging of mass graves in Philadelphia. It's probably the only time after the Civil War that there was any need for mass graves in this country. Well, there may be some disasters like the Johnstown floods, some of the Mississippi floods, but they actually had to dig mass graves in Philadelphia to cope. And they had to open surge hospitals. This is Brookline, Massachusetts. They had to open this hospital on a hill to take care of people, put people in tents. This is in May of 1919, at the end of the second wave of the pandemic. And this is also in 1919 in Lawrence, Massachusetts, an emergency hospital built to deal with it. And they knew it was an infectious disease, and many people thought it was a bacterial infection caused by Pfeifferella influenzae. It wasn't. That turned out to be Haemophilus influenza, which is important, but not a cause of influenza. And so they made vaccines against this bacterium. And one of the major vaccines was made by Dr. Timothy Leary in Massachusetts, different Timothy Leary, in Massachusetts. And this is Mayor Peters of Boston getting a dose of the vaccine. I'll get back to the vaccine later. And this was worldwide. It wasn't only Massachusetts, wasn't only the United States. It was a pandemic. It happened all over the world, almost simultaneously. For example, in Vienna, the artist Klimt and Sheila, who was only 28 years old, married. His wife was about to have a baby. She actually, when he painted this picture, she was still pregnant. He painted the child in the hope of the future, just before he and his wife both developed influenza and died from influenza because they were in that highly susceptible group. And influenza spread very rapidly in a time when the fastest you could go was 35 miles an hour. It crossed the country in a few weeks. So it's fast moving, and that's because you can have a new crop of infection every 2 days. And it's highly infectious, and many people can be infected at once. So you get that impact. And you can see that impact on these charts of influenza in various cities around the world, and you can see what I mean by everywhere at once. It was remarkable how quickly influenza spread. And we had pandemics in 1957, 68, very different. They were more like ordinary influenza. They were severe because many, many people got sick because nobody was fully immune to these new viruses, but they didn't cause the same. This looks very different from the imagery of 1918. And this compares the mortality rate. Now, some people are surprised that only 2% of the people who got influenza in 1918 died from the influenza. That doesn't seem to be consistent. You know, like, why did so many people die? Because 1/3 to 1/2 of everybody got influenza. So 2%, it's estimated that between 500,000 and 700,000 people in the United States died of influenza in that 1 year. That's equivalent to the mortality of the entire Civil War experience. So the impact is great because the attack rate is high, and relatively speaking, the mortality rate is high. And remember, who's dying? It's about 70% of the people dying are between 15 and 44. So Massachusetts, the first cases were in August, as I said. It spread very rapidly. Reporting didn't start till October 1st. So even though they counted 145,000 cases, there must have been many more because they didn't start counting until 2 months into the pandemic. And there were 13,000 deaths compared to 494 deaths from influenza in 1917. The existing hospitals, and remember, in those days, every single community practically had its own hospital. Some of you remember those days. When I started practicing medicine in the community, I went to like 6 hospitals, and I didn't have to travel far to get to them because they all closed while I was in practice. Not because it wasn't my fault. It was going to happen. It was going to happen anyway. And they had to recruit volunteers. As I said, it was difficult to get volunteers. They recruited over 1,000 nurses, and 7 of those nurses died of influenza, and they had 250 volunteer physicians and 4th-year medical students to respond. And the vaccine didn't work. Of course it didn't work because it wasn't a vaccine for influenza. But they were trying because they knew there was vaccines. And the mortality rate varies quite considerably across the state and across the country. And we're going to talk more. We're going to talk more about that. And if you just look at Massachusetts in 1918, the top 10 infectious disease causes of death, influenza and pneumonia were number 1 and 2. And that's unusual because infectious diseases are of a great variety. We're still killing people in those days. And then tuberculosis came up too. And there's evidence now that influenza can precipitate active TB, can be one of those things that causes you to go from TB infection to TB disease. And this is the influenza mortality rate per 100,000 in Massachusetts. It gives you a sense of what the impact was. And if you looked at the 3 major infectious disease causes of death, you can see in red is influenza. You can see the pandemic really lasted for 3 years total before things sort of got back to normal. And you can see that pneumonia was also affected. And, one of the questions that comes up is, why is pneumonia so low here? People should still be dying of pneumonia as a consequence of getting influenza. And part of it is pretty much everybody who was susceptible to dying from influenza probably were more likely to have died in that first year. So everybody who was left was less likely to die. So this had a tremendous impact in mortality. It had a tremendous impact across Massachusetts with very little difference in when it occurred. But I say that, but there were weeks difference between various cities in Massachusetts. So it spread, and we don't know entirely why. Now, quarantine and isolation were used to control influenza. Quarantine is what you do with somebody who's not sick yet, but you're expecting to become sick. And isolation is what you do with somebody who's actively sick and infectious. So schools were closed, churches were closed. There was a variety of things to do. You can imagine how difficult it was for people not to go to wakes and funerals because, people are dying of influenza. The last place you want people to congregate is someplace where people had been exposed to influenza. Subsequently, studies were done on what happened in cities that did various things. And Philadelphia didn't do anything in terms of closing things or not having parades or various other community activities. And they had a high death rate. St. Louis, on the other hand, put into effect a lot of these closures. And some people feel that's why it had less of an impact. So it appears that some of the things that were done in 1918 helped stem the impact of influenza. It might have contributed to the differences that were seen in various communities. That's very difficult to study because various things were done at various times, and there weren't it wasn't an experiment. Well, this city did one thing and this city didn't do it. It was a variety of things, and a variety of things done both officially and unofficially. So it's very difficult to be definitive, but it does look like those communities that did these interventions had a somewhat better outcome with influenza. Now we have vaccines. So in another pandemic, like in 2009, vaccine could be produced. And in 2009, it was almost ready for the major wave of the pandemic in October of 2009. And now vaccine can be made much quicker than it used to be made, and that'll improve. But it's still going to take months to get a vaccine for the next pandemic, because there will be a next pandemic. It's intrinsic to the influenza A virus to cause pandemics. And that's why there's so much concern about avian influenza, there's so much concern about swine influenza. This is where influenza viruses mutate and interact and come out as new strains, causing the next pandemic. But now what they didn't have in previous pandemics, and we had in 2009 and have now, are drugs that treat influenza, can reduce infectiousness, can, if taken before exposure, can prevent influenza from occurring and can shorten the time course of influenza. Now, it only does that by 1 day. So you're sick 6 days instead of 7 days, which for a lot of people say, well, is that really important? But it can also prevent complications and hospitalization and potentially mortality from influenza. So it's something that we want people to get used to now, so that if there is a pandemic, people will be used to taking these medications to try to reduce the impact of pandemic influenza. So that's some background. We'll have questions after Kathy presents.
Thank you, Al. Al is the best boss I ever had. I'd like to begin by thanking the Framingham History Center for allowing me to do this. It's really an honor, and the staff, particularly the research staff that helped me, like Fred Wallace and Ruth Ann Tomasini, that helped me do the research, and also Annie Murphy and Laura Stignola, who helped the administrative staff. And we're really fortunate to have this team in Framingham. It really enriches our community. So Al set us up really nice. You get an idea to understand how frightening it was when this flu the outbreak started. In Framingham, though, we were fighting a war on 3 fronts. We had World War I. We were fighting the outbreak of tuberculosis that was a bacteria, and we're also fighting the flu pandemic that was a virus. So there was a lot going on in the town. This is actually a picture from 1918 of the downtown Framingham. So living in Framingham in 1918, the life expectancy was 48 for women and 54 for men. And the causes of death are many of the things that we have vaccines against today, like polio, typhoid fever, meningitis, diphtheria, measles, and tuberculosis. And the other thing that made it difficult during those times is infants were at very high risk of developing these diseases and dying. Now, in order to understand how Framingham was prepared for the epidemic, what I'm going to do is I'm going to describe a little bit about the Framingham Health and Tuberculosis demonstration that we had the year before the outbreak came. Because what that did is that put a lot of things in place for Framingham so that when the outbreak came, we were somewhat prepared. And in order to understand a little bit about it, what we were doing in 1917 was preparing to fight the pandemic tuberculosis, which was one of the main killers in the United States. It was the #1 chronic disease. It's been in existence for 4,000 years, and we're still struggling to fight it. Now, tuberculosis has 2 forms. One is active disease, where someone is sick and they have symptoms like cough and fever, and they lose weight. And the other one is tuberculosis infection, where you're at risk of developing tuberculosis, but you're not sick from it, but you have some TB germs. And during 1918, 70 to 90% of the public basically were infected with tuberculosis, and 35% of the children. So most people came in contact with that disease. It was so prevalent. And 50,000 of the soldiers that were called up for war were rejected because they actually had tuberculosis. Additionally, it was so frightening because when someone developed it, chances are they did not recover and they may have it for many, many years. They got very, very sick. So there was a fear. So people typically did not go to their doctors till they were very, very ill. Now, these are people that are getting the fresh air cure. Then they're at Saranac Lake. There's a Dr. Trudeau, whose family, many members had died. His brother had just died. He was sick himself with tuberculosis, but the one thing he wanted to do was hike before he died. So he went up to the Adirondacks and Saranac Lake area and just started to stay outside and hike around, and he recovered. And that's how we began to understand that the fresh air cure was a way to treat the disease. At the time, because there's a lot of deaths associated with the disease, Metropolitan Life was interested in trying to prevent the disease and deal with the disease, and they thought the best way to do it, Lee Frankel at Metropolitan Life, was to actually have a community laboratory to test public health models. So what they did is he found some funding, approached the National Tuberculosis Association, and started to then look for a place where they could have a demonstration, a test, and see if they could prevent the disease and cure the disease. Before that, they had met Lillian Wald. She's the mother of public health nursing, and she created these nurses and trained these nurses and felt that it was their civic duty to help create a healthy society and also provide affordable health care. Essentially what she did through some funding is she trained nurses that went into the Lower East Side of New York City where the poor were, and they provided health care to the poor in their homes. But she also, these nurses really understood their community. So a piece of it was the beginning of public health. What kind of a community do you have? What are the risks of the community? And you'll see that this became part of the Framingham model. This is Lillian Wald visiting someone, and this is a woman after my heart that was not deterred and was willing to go over the rooftops of New York City to visit her patients. So Framingham was chosen. What they were looking for is a typical town with a typical representative of all ethnic groups, and that had 10,000 people, that had industry and all. And Framingham was chosen for the place to have this demonstration. We're very lucky because we were competing with 50 other cities and towns for this project. They awarded the town $100,000 for it. It's equivalent to about a $2 million research grant today. And in order to mobilize the community, they had these slogans that they had in the paper. One thing they did is they gave constant updates, we're in town and this is what we're doing, and then they had these slogans, Framingham, the utopian town, the healthiest town on earth. And they also talked a lot about, remember, health means victory. If you're fit, you can fight the Kaisers. And given the fact that so many men were rejected in the service, that this was important. This is Dr. Arthur Stone, who had actually traveled to Germany and worked under Dr. Koch, who discovered the tuberculin bacilli. Also, he was the assistant director of bacteriology and at Harvard and at Mass General Hospital, and devoted a lot of his time to taking care of patients with tuberculosis. Now, he was also a member of the tuberculosis diagnostic standards that set the policies for this demonstration. So we were very lucky that we had him in our town. I think that's probably why we got the contract. This is Dr. Stone in the Stone House that used to be right here on Edgell Road and has moved to Auburn Street, and this is his family here. He attended the academy, which is across the common over there in the Framingham High School, and his granddaughter Janet Wiggins is still in this house. And Dr. now he was also the administrative director of the project. Dr. Armstrong, he went to Columbia School of Medicine and then MIT, got his public health degree at MIT, and he worked for the welfare department in New York City. He was the executive director of the project. So at the very beginning of the project, we have a picture here of the doctors that were trained, and this was really critical to the success because they were trained to pick up the disease early. Prior to this project, most instances of TB were, the cases were picked up when patients had advanced disease. So the key piece here is they got patients when they were early on the disease and therefore had a better success rate of curing. And then on the right side, on the top, you can see these are the nurses, and along with, some of them are local and some of them Lillian Wald had sent, and they trained our nurses in Framingham for the project. And at the very bottom right here is the laboratory that at the Framingham Normal School. So what essentially happened is every house was visited, and an assessment was done at every house. Everybody was offered a physical exam, and the laboratory was used for the lab work. 13,000 out of the 15,000 people had physical exam. Think about that. The year before the pandemic hit, we couldn't have been in a better position. The other thing is the demonstration and all of the doctors had a really good handle on where the vulnerable populations were. So when that pandemic hit, we were somewhat prepared more than anyone else would have been. The other thing they did is they checked the children. They found 11 cases of tuberculosis in the schools, and they also emphasized the importance of the open-air school where the windows are open and there's spacing between the desks. So there was a lot of emphasis on fresh air. And they had fresh air camps, and what they did essentially is the people who had tuberculosis that they could treat in the town, children and adults, were at these fresh air camps, and they were encouraged to have a nourishing diet, rest, and everything that they in fresh air. So there were many scattered all over town, and that really helped to reduce the incidence in TB in the town and increase the cure rates. And also, because we were diagnosing earlier, we were isolating the people that were infectious, so there was a little less transmission going on because of that. And here's another. This was at Bowditch Field. They found children that were very, very emaciated and thin and undernourished, and they targeted those kids so they wouldn't get sick as well. The other thing they did is they had a major campaign in town that was education. They had lectures here on infection control at the Civic Center that's still in downtown Framingham. And they also had weekly updates in the newsletters about all kinds of health. I mean, TB was their focus, but they also talked about dental care, eating well, all kinds of things. So these were all in place before we had the pandemic hit. Now, what happened in Framingham was very critical. What it showed was the number of cases reported in your town is only about 10% of what actually is there. And so you can see what happened is most of the TB cases were picked up when they had the exams in town. But also, the nurses were out, and Edith Blades was one of the ones that was really actively involved in following the families at risk, the families that had TB, to make sure they did not get sick. And she was there the minute someone started a cough. She was at their house to make sure that if they had TB, they were seen immediately. So that was a real significant piece. And again, you're hearing about Lillian Wald going out to the community, not waiting for the community to come to you. So what happened, I mean, this is referred to as the crown jewel of metropolitan health projects, and it paved the way for Framingham to have the Framingham Heart Study, which we're thrilled that we have. It's such a resource for all of us. Is anyone here from there? Oh, thank you so much. I mean, we are lucky that we have this in this town. It's really wonderful. So what they were able to do is prove that you could prevent TB. The TB decreased by 55%. This was the first time they could see this. The TB deaths decreased by 68%. Infant deaths decreased by 40%. And we had far more early diagnosis in dealing with it. So what we were able to do is create this model that every other town in the United States could use. Now, the other thing that was going on is this was followed, because this, again, was a pandemic, and it was followed around the world. So during the war, there was a major outbreak in Italy, and it was among the soldiers in the community. So what they wanted was Dr. Armstrong to come to Italy and deal with this. But the overseers in the U.S. government said, no, he's fighting a different war for civilians that's a very debilitating disease, so they wouldn't let him go. They recommended he not go, and he didn't go. But what they did do is they sent Dr. Louis Bennett, who was one of the managers in the project from Framingham, to help with that outbreak. So now we're going to go to the flu, and think about some of the things that were put in place, and you'll see how Framingham was fortunate in a lot of ways. So as Dr. DeMaria described, there was a lot of fear in town, and there were a lot of stories every night in the newspaper about deaths and young deaths and multiple deaths in families and things like that. So, and then finally we began to see cases in Framingham. Once this began, of course, the Framingham Health and Tuberculosis demonstration did subside and became an auxiliary to the health department in Framingham that oversaw the handling of the pandemic. They offered a lot of resources, not only staff, but they also offered equipment for the hospitals and things like that. So, they were a great resource that we had in town. Then news came into the newspaper that we were going to have at least expect 1,000 of the Navy reservists coming to town that would be staying at Musterfield. And there were some concerns about that, and we began to see this in the paper because there were outbreaks, and they were coming in from Commonwealth Pier, and there were big outbreaks in Boston. But as luck would have it, it turned out that these reservists essentially had not been exposed to the flu, did not have the flu, and they moved them out to Framingham so they would not be exposed to it. So we were lucky, instead of having 3,000 additional cases, we had 3,000 people that were isolated from and trying to prevent the transmission of the disease. Now, we were getting stories about our soldiers and our nurses that were dying, and this is Nurse Margaret Sullivan, who died at Camp Devens at the time, and there was several soldiers, and Al and I went to the same website. We have the same picture. So what happened was as the cases began to come in on September 25th, everything was closed down. The schools, churches, dance halls, everything. You could not even have a meeting in town. And that was the way to again, stop transmission. And that was not uncommon. The other thing they said is to get outside. So this is a common theme, to go outside. They also recommended that you walk to work if you can and not use public transportation. And some towns some cities, they actually shut down their trains because transmission went on the trains. So this again is the Commonwealth demonstration was continuing to send out its weekly newsletters and instructing the public. So it's like it's a severe form of the grip. Don't let the flu come back, and they gave instructions all the time, symptoms of the flu, what to do to prevent it, what happens if you get it. So the town was always being informed. Also, what was happening is the nurses were going out, and actually every family in the town was visited twice during the pandemic to give them instructions and to help them if they were sick. Now, the children, of course, were out of school most of the time. They started in September 4th. They closed the schools September 25th. They opened them again November 4th, and then they closed them again after 4 weeks, and then they were out because they were celebrating the armistice as well, and then they didn't open the schools again until December 30th. So instead of going to school for 16 weeks, the kids were in school maybe 6 out of that time. The other thing that was happening at that time, you can imagine the hospitals were overwhelmed. And we were also getting requests from the surrounding towns, Holliston, Hopkinton. They didn't have a hospital for patients. So there was a long waiting list. Clearly, they had more than they could handle. They had an annex. I think they took over the nurses' quarters because they had so many patients. The other thing that happened, as Alan stated, is that a lot of the nurses and doctors were recruited for the war effort. So staff was not very rigorous. And one of the things that they really had a shot at was nurses. So they asked people to step forward, particularly women, if they could help in the hospital and all. And what happened in Framingham is a lot of the teachers volunteered and went into the hospital. And that was pretty courageous when you think of the death rate, the fear that was associated with it. Just go right in and help. And because they did that, they actually got a raise later on that year. So that was back in the day, you appreciate it. But that was courageous when to walk in the middle, and most people didn't even dare go to funerals. Now, the other thing that happened is there was a community-wide effort at many levels. Since the schools were closed, they used the schools' kitchens to cook food, and the community got involved to cook food for the hospital. Also, the Framingham Normal School, which is now Framingham State University, they used their kitchens, and they also contributed because they were shut down as well. So all kinds of creative efforts were made to really address this. And I had already said that there had been, a second wave that had gone through where they had closed the schools and shut everything down. If you look at the newspaper, okay, we can open everything up tomorrow. No, we can't open it up tomorrow. And the stories were going in the news quite a bit. So how is Framingham prepared? Well, one thing, to step back, the reported cases were 2,000, but they feel as though they really underestimated that, because first of all, they didn't start instituting reporting of the disease till the middle of the outbreak, number one, and number two, when you're in the midst of something like that, reporting is not going to be wonderful. So they really feel as though they had more like 6,000 cases in the town, and they had 118 deaths. Now, we had one of the lowest death rates in the United States because of that. And then following that, the entire pandemic, it's not uncommon for organizations like the American Public Health Association to get together and say, what can we do? What did we do? What new policies can we put in place? And it turned out the ideal circumstances to really control the pandemic had been instituted in Framingham. So there was constant monitoring, early ban. We were one of the first to close. The doctors and nurses were given support, and they were very well educated. All the families were visited. The community, there was a major campaign to teach the community about infection control and what they could do. So, and the community was mobilized. So this really helped. And what I'd like to do now, that's my show, is just give a little plug for the Public Health Museum. It's in Tewksbury, and if anyone is not sure about whether immunizations are a great idea, it's a great place to visit. But they have programs for kids and also college, graduate students, and things like that are available. And if anybody wishes to go, we could arrange something from here. And we'll have questions. Any questions? Yes.
Was the incidence of disease and or mortality from the disease higher among the healthcare workers at the various healthcare venues than among the general population?
There you go.
The question was the mortality rate any worse for the healthcare workers who were taking care of people with influenza versus the general population? And there are not good data on that, but it was very likely that it was, because the attack rate would be higher. It's one of the reasons why we're so concerned about healthcare workers getting vaccinated against influenza now, is that when you're providing care, the next person in could have influenza. You could be exposed, you could bring it home to your family. So healthcare workers are always on the front line in that respect. So, and healthcare workers tend to be between the ages of 15 and 45, so they were also at higher risk from that basis. Part of the problem with sort of quantifying that is that it was so massive and so distributed in the population. It's really hard to say, well, that healthcare worker got it from a patient, or they got it from a relative, or they got it on the streetcar on the way to work. So, but the presumption would be that you would be at higher risk. In those days, though, people with influenza tended, as Kathy implied, that the people got their care in the home, and that people didn't necessarily go to the hospital for influenza.
So you said 15 to 45. I would think that the young, very young, would be very susceptible to this. So can you speak to that?
So in general, in influenza, the very young and the very old are most susceptible to severe illness and mortality. If you took out that 15 to 45 year age group from that chart, you'd see that was true in 1918 too, but disproportionately compared to other outbreaks of influenza, that middle age group. So it wasn't that the young children were less susceptible than they would have been to ordinary flu. They were just disproportionately less impacted than the middle age groups. And as I said, the most popular hypothesis is that this virus, and there's some evidence now that they've reestablished the genome of the virus. It's very controversial, but they did it, and there's some differences in this virus from other influenza viruses that may suggest that it triggered an overwhelming response. For example, if people hear of sepsis, very severe infection, sepsis is the over response to an infection. So if the infection triggers a response that goes way beyond what you need to trigger to deal with the infection, which in and of itself causes damage. And that's what's thought by many to have been the reason why younger people, because older people's immune response is already sort of attenuated, is suppressed. And the younger children were having the same response they would have had with any other influenza virus. It was that middle group that was affected.
Could either of you say, flash forward to the 21st century and say a little bit about the status of multiple drug-resistant tuberculosis?
The drug resistance to TB is a major problem. In fact, there was a UN General Assembly meeting specifically on tuberculosis and specifically dealing with the emergence of multi-drug resistant tuberculosis around the world, to the point where there are some tuberculosis strains that don't respond to any of the major TB drug groups, of which there are probably 7, I think. So that's a big problem. In the United States, there's drug resistance. It's been relatively stable over time, and TB incidence has gone down since the beginning of the 1990s, when there was an increase in tuberculosis. We're hoping it stays down. Historically, every time incidence has gone down, there's been a backing off in resources and attention to TB and a resurgence of TB. So we're hoping that doesn't happen again. And on the world basis, resistance is becoming the major problem because it's very difficult to treat people who have drug-resistant TB. Fortunately, there have been several new drugs developed in recent years which work quite well against TB, and there hasn't been drug resistance yet. The problem with new drugs is that they tend to be more toxic than old drugs, because we've already sort of picked the low-hanging fruit in terms of TB meds, and some of these new drugs tend to have worse adverse effects and side effects, but they're capable of curing TB, because TB is curable with effective treatment. So you can cure TB if you have the right drugs to do it. The hope is that we can make strides in eliminating, because we could also eliminate TB from the world if everybody with TB infection was treated effectively and everybody with TB disease was treated so they were no longer infectious.
Question on a given year. Talk about the different strains of the flu and what might go into a flu vaccine, please.
There are literally hundreds of laboratories around the world that collect influenza virus and test it for what strain it is and whether it's, there's something called genetic drift, which is a gradual change in the virus, and then there's genetic shift, which is a kind of change that causes a pandemic. So they monitor for both, and they now do whole genome sequencing of the influenza virus to see how different or similar it is to previously circulating strains in an attempt to pick up on any changes that might make the existing vaccine less effective so that then the existing vaccine can be modified to be more effective against these strains of virus. So we have something in place now that, and part of the reason why people are so concerned about pandemic flu and avian flu and all of these animal strains of flu is because we hear about them. Before there were these laboratories, they were occurring, we just didn't know about them. So it's really allowed us to have an early warning system for changes in the virus. And that's how the pandemic in 2019 was picked up, because these laboratories started to see this new strain of that virus that caused that pandemic. So that's in place now. So the chances of identifying a new strain early are much higher than they were in the past. And the effective identification of new strains of the virus every year is much better than it was. But the virus is always going to get away from us at various times. And we saw that happen a couple of years ago where the virus was not a good match to the vaccine. Question down here?
I was just curious, looking at that very dramatic spike in 1918, and it falls off really quickly as well. Does the virus have a natural life cycle that it sort of disappeared, or was it all the efforts that were isolating people and the really sick died? Or, I mean, it just seems so dramatic.
So the pandemic strain in 1918 was an H1N1 strain. The question is, people weren't dying the following years. It's sort of, where did it go? It actually, that same virus circulated from 1918 to 1957, when it was replaced by H2N2, which was the pandemic strain so H1N1 circulated until H2N2 came along, and then that circulated until H3N2 came along in 1968. And then H1N1 came back in 1977. And everybody, I think, now agrees that in 1976, when swine flu became a concern, there was a lot of research being done on H1N1 viruses, because that's what swine flu was. And one of the laboratory strain viruses escaped and started circulating in the world population, the Russian flu of 1977. So these viruses are always around, but they sort of adapt, because a virus that kills people isn't serving itself well, because it needs more and more people to sustain its replication. Very simply, it's Darwinian natural selection, and the natural selection is to have an effective host. And to have an effective host, it's better if that host doesn't die before they can transmit it to somebody else. So the virus is constantly adapting to the human population. The human population is constantly developing immunity to various strains. Now, that immunity may not prevent you from getting that virus again, H1N1, between 1918 and 1977, but that immunity may prevent you from getting the severe disease that occurred during the 1918 first wave of the pandemic.
I'll just share a tiny bit of history of my family. My grandparents lived in Yugoslavia on the Adriatic Sea. My grandmother got the Spanish flu in October or before, I guess. And my mother was born in October. and it was thought that my mother, the baby, will die. So she was quickly baptized, and there wasn't any Orthodox priests in the area. We are Orthodox, and so Roman Catholic priest baptized my mother. My mother survived, the baby survived, and my grandmother survived. And I was always curious if there was any connection, any immunity, because neither one of them was getting colds or grippe or anything like that. My mother even refused to have a flu shot, and she was okay.
Yeah, I think the most likely explanation was they survived because they were particularly strong people and had good immune system and survived for that reason, probably. So it's good that you inherited that.
Yeah, isn't there a concern though in modern society with the mobility and the air transport that things can really get out of hand very quickly, and whether or not we have an ability to ramp up the security for getting on planes with people with health risks. I mean, the Ebola virus scared the hell out of everyone when it came out of Texas or whatever.
Yeah, there's a lot of attention to that because, influenza has only a 2-day incubation period. And prior to the 20th century, you couldn't get anywhere in 2 days very far. But now you can get, you can be exposed in one place and get sick the day after you arrive somewhere else. So that is definitely a problem. It's something that people think about a lot. There was a lot of attention to it about 20 years ago, and a lot of study of the dynamics and modeling and looking what happened historically. And it was decided there's nothing you can do about it effectively because there's no way you can screen populations. So there are no plans to monitor or interdict international flights during the pandemic. The focus will be on prevention, hand washing, cover your cough, things like that, because the investment in trying to do something to control travel would outweigh any value to doing it.
Well, my wife and I have a strategy now to put on a good mask when we're on a long flight like this. And you see that Japanese, it's a cultural thing.
Yeah. The masks probably work best for people who are already sick so they don't put the droplets in the environment.
If you don't know that you got it,
Yeah. And
I'm all for masks.
well, it's all right unless you have to go to the bank or something, I guess.
She just mentioned the Spanish flu, and I had heard that there was a flu that went around the year before, like in 1916, 17, and that the people who got that flu either didn't get the 1918 flu or got a very attenuated version of it, and I was wondering whether that was so.
Well, there are hypotheses about the H1N1 being transmitted prior as a swine flu strain prior to the pandemic, and that where that happened, and that might have happened in Kansas in that April outbreak that's felt to be the first wave of the 1918 flu. The problem is very hard to differentiate retrospectively without actually having the virus, what virus. And a lot of this work is done based on population studies, mortality studies, to some extent antibody studies to see what antibodies for specific flu strains people have in their blood. And it's very hypothetical now, and it's going to be very hard to prove that. But some people feel that there was something that happened before 1918 that represented circulation of either that strain of flu or a very similar strain that might have had an impact on the pandemic in certain areas. In terms of Spanish flu, the best explanation of why it was called Spanish flu was that Spain wasn't involved in World War I. So it was very much in the press, in the media in Spain, and there was big outbreaks in Spain that got a lot of international attention. So, and any disease, like syphilis was the French disease, the Spanish disease, the Italian disease. It was like people pointing at each other. There was nothing special about Spain from all indications except that they had less censorship of the press at the time.
And thank you both so much.